Hi, and welcome to the June Ambassador Briefing, featuring information about the Safe Step Act, the CDC Arthritis Program, and much more. Excited to have you here with us today. To kick it off, I just want to do a quick introduction. My name is Julie Eller, and I manage our grassroots advocacy programs here at the Arthritis Foundation. I get the pleasure of working with our ambassadors and our advocates and our junior ambassadors and our platinum ambassadors to help connect people with opportunities to learn how to share their stories to impact decision makers like their federal legislators and state legislators as well. To get to know our whole team, you can learn about who your state director is by viewing this state map. Our state directors are your go-to local boots on the ground resource to make change happen for people with arthritis. If you haven't yet connected with your state director, that's a great first step in getting started with the ambassador program. Send an email today to the folks who cover your region and let them know that you're here and can be a resource as we tackle different policies across the nation and that you're interested in becoming an active ambassador. During today's briefing, we're going to talk through three different sections: our federal updates, our state updates, and then we'll close with our grassroots updates, including our star stories and our assignments for this month. Let's get started immediately with our federal updates. We have three different priorities for our federal area. The first is access to care issues, and we have two updates having to do with access to care. The first is about our Safe Step Act, which is a federal bill to reform step therapy. Our advocates and ambassadors have been active on this issue since getting the bill introduced. They've had an active role in garnering sponsorship, both through letter writing campaigns, phone writing campaigns, and even through our advocacy summit. Excitingly, we've sent over 1,000 letters to Congress about step therapy reform. And so far, 72 representatives have signed on to sponsor the legislation. That's an incredible feat for only having introduced this legislation in mid-April. Your letters have influenced 64 sponsors to champion this bill. So we've reached 64 of the 72 representatives with some form of correspondence, whether it's a social media post or a letter or a phone call. And in person, we've met with 45 of these members of Congress through the Advocacy Summit. So congratulations, your hard work is paying off. And we'll talk about ways that you can re-engage with your legislators later on during our Grassroots Advocacy Assignment section of this call. Stay tuned. The next piece of the puzzle that is important to talk about is our pediatric rheumatology workforce shortage initiatives, ways that we can address this critical shortage for juvenile arthritis patients across the country. You may know that there are about 300,000 children across the United States experiencing juvenile arthritis, and less than 400 or so pediatric rheumatologists specializing in care that can address this critical issue. So far, we are looking to address this issue by encouraging doctors or medical students to pursue a specialty in pediatric rheumatology and then going on to practice in an underserved area. You may know that there are about 8 states that have no pediatric rheumatologists at all. Well, we are excited to report that we have a Senate bill that has been introduced that can help address the pediatric rheumatology workforce shortage by creating such a loan repayment program, S1569. We're also pursuing an avenue through Title VII to increase this access. So you can get involved in this issue by sending your legislators a letter to let them know that you support any action that we can take to increase pediatric rheumatologists across the country. On the research and prevention side, we have a very exciting announcement to make. We have seen some progress in appropriating new funds for the CDC Arthritis Program this year during the appropriation season. The House of Representatives has proposed a $1 million increase in funding for the CDC Arthritis Program. This would mean that we could boost the amount of states that receive funding and grant funding for arthritis programs that can benefit joint mobility and exercise. We may be able to increase that number beyond 13 states. which is an incredibly exciting thing. And if you'd like to learn more about how that appropriation benefits the Arthritis Foundation, like through our helpline and other resources that we have here, I encourage you to watch our advocate webinar from just last week, where we do a deep dive in all things having to do with the CDC Arthritis Program. And we even have Platinum Ambassador Cindy Copenhaver join us to share her personal story advocating for research and prevention for osteoarthritis, and as an exercise instructor for group exercise classes that can help people with arthritis. On the awareness front, we're really excited to share that we have a new champion co-chairing the Congressional Arthritis Caucus. Representative Debbie Dingell from Michigan has joined Representative David McKinley from West Virginia to lead this important bipartisan, bicameral group of legislators who care about arthritis issues. We want to encourage you to work with your members of Congress to join this awesome group that works to make sure that arthritis issues are important, a priority for all members of Congress. We have a special action alert in our Action Center right now that will allow you to connect with your members of Congress, either thanking them if they're already a member or encouraging them to join if they have not done so already. Go on our Action Center, take action today, and consider sharing that action alert with your friends and family to encourage all members of Congress in your community to join the Congressional Arthritis Caucus. Now let's shift to the state. We have 3 state policies that are in the spotlight and have been for this past quarter or so. They're step therapy reform, out-of-pocket cost reform, and mid-year formulary change reform. We've had some serious progress reforming step therapy across the nation with our different state wins, and that can be supplemented by our federal legislation that we talked about just a minute ago. Bills are active currently in Massachusetts, Wisconsin, Florida, Kansas, North Carolina, Oregon, Rhode Island, and Pennsylvania. And we're so excited to have seen successful legislation pass in a number of states this year, including Georgia, Delaware, Oklahoma, Maine, Washington, Ohio, and Virginia. Congratulations to advocates in those states, and stay tuned for ways that you can make sure that those patient protections are being enacted fully in your community. We also want to congratulate Oregon, Missouri, Illinois, and New Jersey for their action on out-of-pocket cost legislation. Those folks are all working hard to make sure that we can reform out-of-pocket costs in their states. Stay tuned and we'll see where those things go. In terms of mid-year formulary changes, this legislation helps to make sure that health insurance plans are not able to make changes in the middle of a contract year, like taking a drug that has been approved and on formulary off formulary. These changes can protect patients from having any surprise instability in their care regimen. We have bills that are active in New York, Pennsylvania, Minnesota, Oregon, Connecticut, and Florida. Maryland has already passed their legislation, and we're right on the cusp of a victory in New York. Stay tuned for ways that we can really encourage the governor to sign that legislation and celebrate that win coming up in New York. Here's a quick glimpse of step therapy reform wins across the nation. You can see in dark green the states that have enacted step therapy legislation since we started this journey in about 2014. This can be a really strong talking point when you're working with your federal legislators to let them know the strong support for step therapy reform across the country, to encourage them to expand those protections to all patients on commercial plans through the federal step therapy legislation. Congratulations to all of our grassroots advocates who are making these dark green wins possible. And stay tuned for those lime green states that may still have a win in them coming up this year. And just briefly, we wanted to show you our 125 plus state legislative victories in all policy areas outside of those spotlighted ones. We are filling this map up. We have, excitingly, a victory in all 50 states in our work to break down barriers to care, and we hope to expand those protections and educate our communities on what those protections are. We're going to have lots of resources coming down the pike in 2020 to prepare all of our advocates and patients with the resources they need to make sure that they are benefiting from the protections that are granted under these new laws. Now let's take a step back, because I know that we've talked about the policy broadly for the last few minutes, where we've had wins, where we haven't had wins, what the policy sounds like. And I want to take a step back and make it personal for a moment to talk about the ways that our advocates are having success taking action throughout the year. So let's zoom in on HB 63, the Step Therapy Reform Bill that recently passed in Georgia. You can see in this infographic in light blue the advocate actions that were taken during this year to make this victory possible. In green, you can see what actions were taken by legislators to get this bill from introduction to passage. You'll see that there are lots of touch points for advocates to take action, whether in this case it's a state legislative day, or taking action through the Action Center, signing a petition, meeting with legislators. There were so many opportunities to engage, and I firmly believe that this bill's success is rooted in those touch points and those engagements. So we often think about legislation as, we need to share our stories right now, talk to our legislators and educate them about this issue. But this timeline reminds me of how important it is to continue that outreach. It's not just this first time that we're going to reach out to them and ask them to introduce the legislation. We have the power to make a change throughout the process. And so we need to be actively engaged from step A to step Z. So I encourage you, as you look at actions in the Action Center, as you think about ways that you can change policies across the country, just remember that it's not just this first letter that you send, but it's the letter and the phone call and the in-person visit that can really make a difference, because it shows that you care, not just in one moment, but throughout your full patient experience and journey. Continuing our shout outs from Georgia, I want to shout out some individual star stories of ambassadors that have been taking really remarkable action across the country. We have more than what is on this slide, of course, but just a few people who we want to recognize this month, are Helen King. Helen is a Platinum Ambassador in Pennsylvania, and recently she invited her representative to join her at the Walk to Cure Arthritis, where she happened to be the National Adult Walk to Cure Arthritis honoree. She invited her legislator to join the event, and he was able to join. And not only was he there to spread awareness and to promote arthritis issues in Congress, but he also, from the stage, announced his sponsorship of the Safe Step Act and his interest in joining the Congressional Arthritis Caucus. And that was our assignment just last month. So we want to congratulate Helen and congratulate all of you who have taken action to invite legislators to come to your walk events, because it really does make a difference. And if you didn't do it this year, set your sights for next year, because it definitely is an opportunity to share your story and make a difference. So congratulations, Helen. Another star story for today is for Cindy Copenhaver, who spoke on our most recent advocate webinar about her experience raising awareness for the importance of osteoarthritis research and prevention programs. Cindy was just a joy to be a speaker on the call with us just last week, and really her work to serve as a patient spokesperson for different research bodies is just remarkable. So take a listen of that webinar so you can hear her full story and hear about some of the ways that she works to increase access to care for patients across the nation. Amy Barron gets a shout out for her work serving as a patient reviewer for the congressionally directed medical research programs at the Department of Defense. Amy was a nominee by the Arthritis Foundation to share her experience and story, and she's been working to identify potential grants that are potential research programs that should be funded by the department. So she'll work to identify different clinical trials that they should fund and provide her patient experience to say what is central and important to people with arthritis across the nation. Kudos, Amy. I also want to give a shout out to Kathy Garant, who's been doing a little bit of different advocacy. Kathy has been working to make sure that her local leadership board in Ohio knows how to use the Action Center, how to take action, and she's been holding them accountable, trying to make sure that she has 100% actions from her LLB over in Ohio. I want to encourage you to be empowered by Kathy's experience. She's been met with enthusiasm from the LLB and has had a really strong response in folks who have had uptake in taking action there. So I encourage you to make that a priority for yourself. It's a great way to gain a bonus assignment is to go and teach a small group about how to use the Action Center. And we have tools and resources that can help. So just reach out to your state director and we can make it happen. I also wanted to commend both Rhonda Mack and Stephanie Quetchen for their work in strengthening the Congressional Arthritis Caucus. Rhonda, a Platinum Ambassador from Arkansas, made that one of her main goals as an Advocacy Summit ask, and then her consistent follow-up in letters and phone calls to her representative encouraged him to join the Congressional Arthritis Caucus. Same goes for Stephanie, whose enthusiasm and encouragement of her representative encouraged her to not only be a strong member of the Congressional Arthritis Caucus, but also to become a co-chair as a leader of the group of the caucus. A final shout out goes to our Patient Leadership Council, who all joined us in Washington, D.C. just earlier this month to join us and serve as expert panelists, sharing their patient stories and helping to teach colleagues across the policy spectrum about what is important for patients with arthritis. To continue our grassroots glory kind of conversation, we want to give cheers and shout outs to a few more folks. First off, I want to recognize that Carol Riley of Delaware, our advocacy chair there, testified on the importance of step therapy reform in her home state of Delaware. Shortly after that testimony, we did see a legislative victory there. So congratulations to Carol. We did close out our 2019 State Legislative Day event season, and we're proud to have more than 400 advocates who met with legislators across the country. Special shout outs do go to those final states, California, Pennsylvania, and New York, who helped us to finish this event season strong. Stay tuned for where events will be held in 2020. We have had advocates featured in the news, ambassadors featured in the news. Gay Jacques of New Hampshire has been published again and again by the Laconia Times, her local newspaper. She submits stories for publication there about lots of different ambassador activities that she has accomplished, always seeking to raise awareness for people with arthritis. She is a beacon of hope for all of us who are working to get published across the country. So stay tuned on different ways that she has shared her story and ways that you can do so too. We also saw a great Medium article come out earlier this month that featured Katie Roberts' story about step therapy and the importance of reform. Now, to give us all a pat on the back, no names specific, we've had some really remarkable grassroots actions taking place across the states. In terms of step therapy reform, we have had almost 190 senders send over 300 messages to state legislators where we've had active legislation this session. In terms of utilization management, which includes both prior authorization and some step therapy wins, we've seen 135 senders send nearly 300 messages to their state legislators about the importance of reform and patient-centered reform at that. We've had almost 100 senders send messages about out-of-pocket costs, with over 150 messages to their state legislators about how important it is for patients to be able to afford and access their care. What a whirlwind of grassroots successes. We're so proud to shift that narrative now from what we've been successful with to what we can take action on. So to focus in on our June activities, we have 3 things on the horizon for all of you. The first is our CDC Arthritis Program letter campaign. As we mentioned before, we have had a proposed $1 million increase from the House of Representatives for CDC Arthritis Program. We really want to make sure that we secure that $1 million of additional funding, and so we must focus our energy on the Senate. The Senate has not yet marked up their appropriations legislation, and so it's our job to educate the Senate on why the CDC Arthritis Program is so important. Take a look at our Appropriations for a Cure guide, which can prepare you with a draft letter that you can send to your senators about the importance of this initiative, and that will teach you more about the CDC Arthritis Program and why it's important for us to raise awareness for the resources and help that are delivered through this important program. An additional activity is in the shape of our Step Therapy Reform social media campaign. We're excited that we have 72 representatives signed on to sponsor our Safe Step Act legislation to reform step therapy nationwide. What we've done is created 2 different graphics, one that thanks legislators who have sponsored, and another that encourages legislators to sponsor the legislation. In this assignment, you'll do some research to understand if your representative has yet sponsored the legislation. And then you'll post a message on social media, either on Twitter or on Facebook, to encourage your member of Congress to support this important legislation. In your guide, you'll have sample tweets and Facebook posts with guidance on best practices here. One thing I really want to encourage you all to do is, if you're tweeting, make sure to broadcast your tweet rather than narrowcast your tweet. So if you should be tagging your member of Congress and that tag taking place at the front of your tweet, you'll want to put some words or a period in front of where you'll place that tag. Take a look at Samantha's tweet here. Her tweet makes sure that the message will be broadcast to her member of Congress, so it will show up in everyone's Twitter feed, rather than just having a narrowcast message, which would only go to that member of Congress. So this helps really gain traction with your messaging. Samantha says, from a 3-season varsity athlete to not being able to walk, arthritis has changed my life. The last 4 years have been a struggle, but I won't give up. At Rep. K. Clark, please help those with chronic illnesses have better access to life-saving medications. Hashtag advocate for arthritis. This is really a perfect tweet because it not only tags Samantha's legislator, but also uses the hashtag advocate for arthritis so that we can track her message and track her success. One additional thing to think about this month is August recess, our cornerstone assignment, which is just a few weeks away. What you can do is opt in for August recess, or opt in for the opportunity to meet with your member of Congress or state legislators in person during August and September. And as a new part of August recess, you'll be a recipient of our 2019 August recess handbook just by opting in. Our handbook includes all the different ways that you can connect with your legislators this summer. It has information about how to schedule a meeting, how to have a virtual meeting, how to attend a town hall, and more. It's our newest and most robust resource for tackling August recess in full. This handbook will be your guide to success this summer. So opt in today. You can see our form available in the Action Center, and it should be available also in your newsletter announcing the initiative. And in early July, we'll come out with a supplementary video like this briefing to go through the handbook in full and share with you all the different things that you can do to prepare for these important visits. I want to encourage you and remind you that these visits are accessible to all ambassadors, that you've been preparing for these visits since the start of this ambassador season, and that all patients and caregivers are experts in their experience. So no matter what, even if you're not an expert in all of the policies that we're going to be tackling this summer, you are an expert in your experience, and that is everything that members of Congress and state legislators need and want to know. You'll help put the person behind the policy. So sign up today and we'll prepare you with all the resources that you need. Before we work to sign off I want to remind you to report your ambassador activities. Reporting your activities is the most important thing that you can do to help us track our progress throughout the year. And it's a really easy thing to do. So first you'll go to the Ambassador Reporting Center in the Ambassador Program section of our website. There you can click into all of our ambassador reports, provide feedback on the activities that you've accomplished, and let us know what we can do to support you in next steps. These reports will be used to log how close you are to the Platinum Ambassador Award, which, by the way, we're getting closer and closer to tallying up our final awards very shortly. And it's a really great way for us to help understand what the landscape is across the nation so that we can be more proactive with the legislators who have been reached out to, encourage more ambassadors to take action, and see more of what goes on. But it's not just a benefit for us, it's also a benefit for you, and I want to show you how. When you click into Report Your Activity and submit your form, you'll get a confirmation email from me. In your confirmation email, at the very bottom of the email, there is a link, and that link will take you to your personal reporting section of the website. So when you click on that link, you can see your full activity report for all of the things that you've accomplished through our program throughout this year and beyond. You'll get to see your whole longitudinal history of what you've accomplished through our system this year. You can see any of the action alerts that you've sent through the Action Center. You can see any of the areas that you've submitted an ambassador report, and you can see all of the language. So get in there and click around and see what you've done, because you are sure to impress yourself just by logging that activity. And you'll be up and considered for the Platinum Ambassador Award this year. Remember that it's 10 ambassador assignments that you'll need to accomplish, with 6 bonus assignments and a fundraising minimum of $1,000. And there are ways to report all of those things right in the Action Center, and then to see what you've reported in your activity report. You can click in, like I said before, and see what different feedback that you've provided so that you can really dig in and understand what it is that you did, and you wouldn't have forgotten because you'll be reporting as you accomplish activities. One additional resource that I wanted to mention before we sign off is our new Advocacy Storybank, new and improved. We're asking that all of our ambassadors take action and share their stories with us so that we can think about more specific ways to pair you with the resources you need to be successful in sharing your stories with decision makers. Take a look at our story bank today and submit your stories and share it with your friends. To close us out, I wanted to provide you with my contact information. You can reach me at jeller@arthritis.org by email anytime. And to give you a reminder that our next live briefing will be August 21st, my birthday, at 3 p.m. Eastern Time. You can check out our current ambassador assignment page for more information throughout the summer on activities that you can do and accomplish. And you can expect to see an additional supplementary briefing on August recess coming out in early July. I'll talk to you then, and I appreciate your participation in this virtual briefing. Thanks so much for joining us, and I'll talk to you soon.